Hello, this is Dr. Huang with the ECR Video Library Series, and we'll be talking about melatonin's role in pediatric insomnia. So our learning objectives will be 1. Define and understand pediatric insomnia. 2. Learn about the melatonin as a hormone. 3. Recognize melatonin's role in treating pediatric insomnia. 4. Discuss how and when to use or dose melatonin as a treatment for pediatric insomnia. 5. Understand melatonin's side effects. And 6. Know about the limitations to current melatonin preparations available on the market. So what is pediatric insomnia? Pediatric insomnia is reported in up to 25% of healthy children and in 75% of children with neurodevelopment disorders such as cerebral palsy and psychiatric conditions such as ADHD, resulting in negative consequences. It's defined as repeated difficulty with sleep initiation, duration, consolidation, or quality that occurs despite age-appropriate time and opportunity for sleep, leading to daytime functional impairment for the child and family. In other words, it's repeated difficulty with all phases of sleep, falling asleep, staying asleep, waking up to sleep, the quality of the sleep, despite having enough environmental influences and enough opportunity for the kid to sleep, which then in turn leads to inability during the daytime to function for both the child and the family. So where's melatonin's role in this? Well, a little bit more about melatonin. It is a natural hormone. It is produced by our body in the brain in a small gland in the brain called the pineal gland. And as you can see from this figure right here, it is influenced, its production by the brain is influenced by either the light period or the daytime or the dark period, the nighttime. When the nighttime happens and there is no light, it stimulates the suprachiasmatic nucleus, which signals the pineal gland to produce more melatonin. During the daytime or when there is light, this whole process is inhibited. So therefore, no natural melatonin is produced during the daytime, only at night. Adults, they typically produce 20 to 60 micrograms of natural melatonin every day. Just as a reference, the melatonin that you see on the market is dosed in milligrams, which is about 1,000 times more, anywhere between 1 milligram and 12 milligram. And the main role of melatonin, as we discussed, is to function and regulate the body's clock and keep it in line and correlated with the day and night cycle. So as you can see, that it plays a pretty critical role in sleep. And as we can see from this graph here on the y-axis, this is how much natural melatonin your body's producing. And on the x-axis, this is the time of day. As we see around typically 8 p.m. for adults, melatonin production increases, and they start to peak in the middle of the night, typically around 2 a.m., 3 a.m., 4 a.m. And then as the body is starting to wake up and as there's daytime and sunlight, melatonin levels fall by early morning. So there is a wide perception that melatonin, over the counter that is completely safe because it is naturally produced by our bodies. But there has been very few studies looking at the long-term consequences, especially in children. In the short term, it appears to be safe, and that's why you see it in available preparations in pharmacies and supermarkets and whatnot. But really, the long-term consequences of using melatonin day in and day out for years on end has really not been studied well in children. So like I said before, melatonin's release and inhibition or not release affects the body's sleep-wake timing. So as you can see from this wonderful figure here, there are many things that happen to signal the body to go to sleep, to stay asleep, and then also to wake up as well. So as we discussed in this graph here, typically around nighttime when there is no light outside, it signals the suprachiasmatic nucleus in the brain to produce, to tell your pineal gland in the brain to produce some melatonin. And this sets off a cascade of events and effects on the body. For example, your blood pressure starts to lower, your body temperature starts to decrease as your body prepares for sleep. And then when your body's in deep sleep and when melatonin's at the highest is when around about the middle of when you're asleep. And then as melatonin starts to get inhibited or not produced anymore, as there's more light in the early morning, then the other effects like your body's increase in body temperature and an increase in blood pressure starts to occur as the body typically wakes up. So typically because we've found that melatonin is so involved in the sleep-wake cycle, we can use it, the thought is to use it as a hypnotic to promote people, including children, to fall asleep. So what kind of I like to call it melatonin's enemies, or things that would counteract melatonin. So as we saw in this first figure, any sort of light tells the brain not to produce any melatonin. So you can imagine that it doesn't have to be sunlight. It can be light from screens, like especially the blue light, or any artificial lights like your room light. This can actually trigger your brain to stop producing melatonin even during the nighttime when it's an appropriate time to sleep, therefore tricking your brain that it's daytime and that it should not be producing melatonin and it should not engage in preparing your body to sleep. So studies have shown that, like we looked in the graph below, melatonin begins to be released at about 8 p.m. for school-age kids. Starting when they hit the age of 12, when they start to become teenagers, we have found that melatonin begins to be released at 10 p.m. And we typically correlate the time in which children of ages should sleep as when the time that melatonin begins to be released. So let's talk a little bit about melatonin as an over-the-counter drug. Just a little bit of more information about the whole process. Melatonin over-the-counter is actually not regulated by the FDA or Food and Drug Administration as a medication. It's regulated as a food supplement. That is a key word because supplements don't undergo the rigorous testing and safety testing that medications go through. Therefore, it hasn't had extensive research done on it. So the safety, especially the long-term safety of melatonin really cannot be guaranteed because there's no official FDA approval. And as a result of no FDA approval, you see a lot of companies making different melatonin preparations. Some of them have different amounts of melatonin in them. Some of them even have variable quality, concentration, and potency, or how effective the medication is or how strong it is. So sometimes it's kind of a wild, wild west out there in the over-counter supplement area with melatonin. So what can we use? What has the research shown us to help guide us in using over-the-counter melatonin? Well, research has shown that you should try to probably use the smallest doses possible, and that's more of a lack of research of the long-term effects. So just using the smallest dose possible for the shortest amount of time that helps a child initiate sleep is probably the safest bet. It does not stop overnight awakenings. So remember, melatonin is secreted by the brain, and it's kind of a signal to tell your brain it's time to sleep when I sense that there's no light outside. But when you're already asleep, melatonin seems to not really play that much of a role in keeping you asleep. So that's why melatonin is really used only for the initiation phase of sleep, or when it's difficult to fall asleep. And as such, that's why it's more recommended to be used for people as they're starting to drift off to sleep, to kind of reinforce and increase the amount of melatonin in your body to really tell your body, look, it's time to sleep. So where does this fall in as a psychiatrist? Where does the use of melatonin kind of fall in my field of work? Well, specifically with kids with especially autism spectrum disorder, ADHD, persistent chronic insomnia, melatonin can be used as a supplement to help them achieve sleep. Sleep is something very important. It resets the brain. It allows the body to rest. And even in things like mania that I see when people don't get enough sleep, it can cause a lot of distress, cognitive impairment, even in both adults and children. So extensive studies show that the children with these psychiatric diseases respond well to melatonin as a hypnotic agent. You want to typically give the melatonin about 30 minutes to 60 minutes before you want them to fall asleep. And interestingly, it has a very strong evidence for using in this syndrome called delayed sleep phase syndrome, where kids, typically teenagers, are not able to fall asleep till 1 a.m. or even 5 a.m. And so, like as I said before, you want to use the smallest dose possible. I've seen small preparations of 0.3 milligrams to 0.5 milligrams, and give it to these children 4 to 6 hours prior to the current time of sleep because they're sleeping so late. And every 4 to 5 days, try to move it back more when you give the melatonin to try to get them to sleep at a more reasonable hour. So when you're in the store looking to buy melatonin, you want to look for the smallest dosing packet. You can see some as low as 0.5 milligrams or 1 milligrams. You want to give it about half an hour to an hour before sleep to give it some time to get digested in the body and into the system, and also, except unless you have delayed sleep phase syndrome when you're sleeping, your teenager or child is sleeping at 1 a.m. or 5 a.m., that's when you want to give it a little bit, 4 to 5 hours more before that. If you're not seeing any effect after 3 days, you can increase the dose by, let's go small increments of 0.5 milligrams. The highest dose recommended is 6 milligrams. There's not much research to show that really high doses like 10 milligrams are more beneficial than 6 milligrams. So research pretty strongly points that 6 milligrams is the highest dose recommended. And if it's not effective, you might want to look at other things. So once you've achieved and you're able to fall asleep on melatonin, you want to continue to maintain adequate sleep hygiene, and we'll discuss what this means. Once it's much better for the child and easier for them to fall asleep, you can start backing off on the dose of melatonin. Just as we said, there's not really much evidence for long-term use, but there is good evidence for short-term use. So what are the melatonin side effects to watch out for? Well, melatonin is a signal to your brain to start sleep and to change the body's and prepare it for sleep, like reducing your blood pressure and reducing your temperature. So you can have side effects. You can have morning drowsiness because your body thinks it's asleep. You can have bedwetting. You can have headaches. You can have dizziness and nausea, as with most medications. You can even have nightmares in some reports. And you can have diarrhea. There is a theoretical side effect. It can maybe lead to persistently elevated blood melatonins throughout the day because your body produces your own melatonin, which can lead to kind of persistent sleepiness during the day. But that's more theoretical. The thought is that your body does a good job in sensing how much melatonin you have in your body, and if it has too much, then it's not going to produce its own. So this is what I wanted to talk about in regards to good sleep hygiene. Melatonin is not a substitute for good sleep hygiene. It's a supplement, so it's not going to help someone fall asleep and stay asleep, especially long term. The most evidence and the best practice is actually good sleep hygiene. Now, what does that mean? It means having a consistent go-to-bed time. It means have a consistent awake time. It means having just a consistent bedtime routine every night, and this consistency is key. Our bodies don't like change. It also means trying to avoid light in the room. As we discussed before, light tells your brain to stop producing melatonin, which means to tell your brain to wake up. So trying to avoid blue screens like phones, like tablets, like TV, like computers, especially when it's time to sleep. Keeping the room at a cool temperature, keeping it pretty cold at 69 to 71 degrees Fahrenheit, because this kind of signals your body to also fall asleep as well. Getting sun exposure, so it's not just simply not keeping it dark at night, but it's also keeping it light time when it's supposed to be awake. So trying to get that sunlight, opening windows when it's time to be awake, and not sleeping on an empty stomach, having a comfortable bed, and just trying to minimize the distractions and noises during sleep. So just as an aside, we have to, because it's not FDA approved, we have to be a little bit cautious when looking and shopping for melatonin over the counter. They can vary in the dosages, anywhere from 83% to 500% of the labeled dose, so 5 times even. And sometimes some researchers have found other hormones that are in the melatonin preparations that we don't want, like serotonin. So what you want to do is you want to look on the labels of these over-the-counter melatonin preparations, and you want to see this USP verified mark, which shows that it meets the requirements of this convention, and it has and we know that there's no other drugs or no other hormones in the drug, and we know that the label accurately says and tells what's in the drug. Interestingly enough, the only places where you can really get melatonin as a prescription from your provider is Australia and the United Kingdom, and not really in the US. So what are the take-home points for melatonin? So when you want to use the over-the-counter melatonin to help you fall asleep, you want to take it about 30 minutes to 60 minutes before your desired sleep time. But remember, the most important thing is not actually melatonin, it's having good sleep hygiene, having consistent bedtime routines and wake up times and sleep times, minimizing lights and noises and distractions, and keeping the room cool. A lot of people tend to use melatonin because it's convenient. It's a pill. It says that it's going to help you fall asleep. But if you're not having these good sleep hygiene practices, melatonin is going to be rendered useless. And you want to use it for as short a time as possible. Once you get your desired results of having your child or you yourself sleeping at the right time, then you can start to wean off the melatonin, because the long-term effects are not really well understood. So those are the main points for melatonin in the treatment in pediatric insomnia. Thank you for listening.